In JAMA, researchers report on a meta-analysis of randomized controlled clinical trials assessing associations of structured exercise training regimens, including aerobic exercise, resistance exercise, or both, and physical activity advice with or without dietary co-intervention on change in hemoglobin A1C in type 2 diabetics. Pooled mean differences in hemoglobin A1C levels between intervention and control groups were calculated using a random effects model. Overall, structured exercise training was associated with a decline in hemoglobin A1C level compared with control participants, and it made no difference what kind of exercise the patients used. How much did they have to exercise? Structured exercise durations of more than 150 minutes per week were indeed associated with hemoglobin A1C reductions of almost 1%, while structured exercise durations of 150 minutes or less per week were associated with reductions of only 0.33%. The best outcomes were in patients who combined physical activity advice and dietary advice. Physical activity advice alone was not associated with hemoglobin A1C changes. The good news is that structured exercise training that consists of aerobic exercise, resistance training, or both combined is associated with A1C reduction in patients with type 2 diabetes. But it takes a lot of exercise. Structured exercise training of more than 150 minutes per week seems to be the necessary amount, and it is indeed associated with greater A1C declines than that of less than 150 minutes of exercise per week. The bad news is that physical activity advice is associated with lower hemoglobin A1C, but only when combined with dietary advice. You can't eat your cake and get away with it. I'm Peter Block, and this is a CardioSource Heart Minute.